Um, we get started here for our Healthy Oregon Workforce Training Opportunity Grant Program Advisory Committee meeting. We get the opportunity to get together with the advisory committee twice a year, so excited to share some updates with you all and have some discussions about both some of the most recent work for the program and what we're looking for ahead. Um, just to get us started, my name is Melissa Yates. I use she, her pronouns, and I am the HOWTO Grant Program Coordinator here at Oregon Health Authority. Um, for a brief visual introduction, I have short brown hair, white woman, my black and white top, and then behind me, my background is blurred out. Um, we do record our meetings for this group, and we'll have them posted for folks who aren't able to join us. So you should have gotten that little reminder from Zoom that the meeting is being recorded as well. All right, so just to get started, we'll go over just a few logistics with the group. And if we could have our next slide, please. I know so many of these things are very familiar to us all, but I think it never hurts to just take a minute and remind ourselves. As I mentioned, the meeting is being recorded. The How-To Advisory Committee meeting is open to the public and does welcome public testimony. We'll have time set aside here in just a couple minutes for public comment. We do have captioning available for the meeting, which you have the ability to turn on in your Zoom window down at the bottom. Sometimes it gets kind of tucked away under the More option, so that's available to you there. For our advisory committee members, I see, I can already see several folks have done that already, but it's always really helpful to have folks, if you are able to, just hover over your displayed name in your Zoom window. If you right click, you can rename yourself. If you put CM for committee member, along with your name, that can just be helpful for us as we're kind of organizing ourselves and keeping an eye on making sure we've connected with everybody. It also gives you the opportunity to add your organization name for committee members or others if you'd like to do that in addition to your own name. We also do appreciate, as we're working our way through, not a huge group, but still enough of us. If you'd like to ask questions or add comments, you're always welcome to drop things into the chat, or if you want to raise your virtual hand here in Zoom, that's always helpful for us as we're facilitating conversation and discussion as we work our way through the meeting as well. For Zoom, it's the raise hand feature is actually under React. So you can click React and it will give you the raise hand option there as well. All right, kind of flying right through the logistics so we can get into the heart of things here. Next slide. Oh, thank you. Annette is our behind the scenes wizard. Thank you, Annette. So for our agenda today, like I said, we're covering some of these logistics and welcome. We'll have our public comment section here in just a minute at the beginning of the meeting. And then we'll spend some time just hearing from our OHA staff and our committee members for some introductions. This group gets together twice a year, as I mentioned. So it's an opportunity for us to hear from you all on what's happening in your world as well. And then we'll get into providing some how-to program updates. When this group last met, the request for grant proposals was still just posted. So we've made decisions there and move ahead through that process. So we'll have more details to share with you there before we take a break and then come back and talk more about a few things that are ahead for how to. So looking at the next round of planning for the next round of funding, and then also a conversation on advisory committee recruitment for this group. All right. So that brings us to our public comment period here. So like I mentioned, public comments welcomed. We ask that folks try to keep it to 2 to 3 minutes. I know we haven't had anyone sign up in advance, which isn't required. Folks can still attend and provide comment without having previously signed up. We welcome hearing from community members on topics related to the HOWTO Advisory Committee or other things that the public wishes the committee to consider. And just note that we don't respond to the public comment during the meeting, but we will get contact information from anyone who wants to share and then follow up after the meeting as well. So if we have anyone who would like to provide public comment to the HOWTO Advisory Committee, now would be the time. If you want to raise your virtual hand or come off mute to let us know. Sounds like we might not have any public comment for today. Give it just another minute in case anyone is battling with technology at all. All right. Well, we'll go ahead and move on to the next section of our agenda then. But if anyone wants to provide input or feedback to the program, we'll have an email address that we'll be sharing as well that you all can reach out at any time. So that brings us to our introductions. As I mentioned, we just wanted to take a minute to let you all know who's here with us today in support of the advisory committee, as well as who's here as our advisory committee members. So you all already heard from me. As I said, I'm Melissa Yates. I use she, her pronouns, and I'm the HOWTO program coordinator. And if I could pass it over to Ritu for an introduction as well.
Hi all, my name is Ritu Tangana, she, her pronouns. I am currently in rotation as the Healthcare Workforce Team Manager, and I'm supervising the HOWTO program. Am I passing it to Neelam, Melissa?
You can pass it to Neelam, that works great.
Okay. Oh, I see Katrina too in the group, so I'll go by the order. Katrina?
Hi everyone. Excited for this small but mighty group today. My name is Katrina Dowdy. I use the pronouns she, her, and hers. I was on a job rotation supporting Melissa and the rest of the HPA team, and am rotating back to the equity and inclusion team next week. So I was grateful to be a part of the journey, and you are left in Melissa's very, very capable hands. I will pass it back to Neelam.
Thanks, Katrina. Hi, everyone. Neelam Gupta, she, her pronouns. I'm the Director of Clinical Supports, Integration, and Workforce here at OHA. And I will pass it to Annette.
Thanks, Neelam. I am Annette Pierce. I use pronouns she, her, and I'm an administrative support specialist working to share my screen and support your meeting today. And I'll pass it on back to Melissa.
Thanks, everybody. So we will, we have lots to talk about today, never any shortage of things to cover. But as I mentioned, we want to spend some time at the beginning of our meeting to also hear introductions from our advisory committee members. And, oh, sorry, Annette, previous slide, please. Thank you. And so what I'll do is kind of work our way through our advisory committee roster, just so we don't have to, I know sometimes the popcorning it around can make it hard for folks to know who to pass it on to. So I'll work my way through our list. I did hear from a few folks this morning who were planning to attend and had a change of schedule. So we will work our way through and see who has been able to join today. So I am going to start off with passing it over to David Robinson.
We'll just make sure he's off, not on mute, which is usually the case. So David Robinson, he, him pronouns. I'm the Executive Vice Provost here at Oregon Health and Science University. What is your current rose and thorn? Well, I don't know how long we have, but I suppose the rose, this time of year, we're getting ready for graduation, commencement, which is always a great time of year for us. We have about 1,000 students usually graduate every year. Vast majority, obviously, into health professions, so we do have some non-health profession degrees. And we're also finalizing all of our admissions for the fall. In fact, some of our LPS students, for example, start actually in June 28th, I think, this year. So it's an exciting time of year. So that's kind of the rose side of it. The thorny side is OHSU is obviously doing an awful lot of work related to impacts of various federal executive orders, the current financial climate that everyone across the nation's struggling with, and getting ready for our budget to propose to our board. So those are thorny issues that we're always tackling.
Thank you for that, David. And thank you for also modeling the prompt that I hadn't described yet. So appreciate you taking the first turn at that. And I'll pass it over to Robert Dumig. If you could also introduce and share the rose and thorn, highlight, low light, however folks want to think about it, of something that you might be seeing in your work and your community.
Yeah, hi, Robert Dumig. I am the director for the Oregon Office of Rural Health. My rose is really all the communities we keep working with out in rural Oregon. And I would say the biggest thorn or thorns is pretty much everything going on in DC at the moment when it comes to programming and funding challenges that we're facing.
And I will pass it over to Carrie Norris.
Hi, I'm Carrie Norris. I'm Workforce Development Program Manager here at Samaritan Health Services. I would say the rose right now is that we are at the precipice of starting participation with the brand new surgical technologist apprenticeship that SOIB, the Regional Workforce Board, is standing up. They've been a great partner for the MA, and this has been a long road to get to this point. So we're very excited with that. Thorn, I will reflect what everyone's already said, and I imagine people will continue to say limited resources and uncertainty make it real difficult to do long-term planning.
Thank you, Carrie. Yeah, I think we'll hear a common theme for sure. I will pass it over to Claire.
Hi, I am Claire Trencaise. I use she, her pronouns, and I work for the Oregon Primary Care Association. Let's see, I have two roses. Otherwise, I'm in the same thorny patch with everyone else. But the roses are, well, one, we have a new workforce development manager, and Michelle Bowers, I think, actually is just listening in today on this meeting because I'm trying to get her used to all the workforce circles throughout the state. She comes with a lot of knowledge, but just getting her up to speed with all the groups we engage with. And the second rose I have is part of what we call our workforce retention efforts, and that is a sabbatical that you get every 7 years. So I'm actually at 14 years, and I'm taking off May through July, and I'm pretty excited. That's all.
Congratulations for that, Claire. That's incredible. I will pass it over to Rob. If you could introduce yourself and share a rose and thorn that you're seeing.
Absolutely. My name's Rob Ross. I'm in Bend. My pronouns are he, him. I work for St. Charles Health System as the Director of Academics and Research. A rose, a great rose, just that we're now going to receive the 3 residents or more into Madras in combination with OHSU to start on their rural training program in the summer, which is great. And that was supported by a HOWTO grant, round 3, I believe, which we've almost completely exhausted. So that's awesome. And it's a beautiful day here. I took my dogs out for a bike ride. They're all very happy and quiet. They're not barking. The thorn, I reflect on, everyone else's comments, but David and I work for large organizations. The current thorn in my side has been trying to get a psychiatry residency up and running in Bend because Oregon so desperately needs psychiatrists. This is in combination with OHSU and St. Charles, and large organizations have a very hard time making decisions and committing. And whether or not Medicaid has cut $800 billion, it won't matter to the patients, and the amount of money spent on this sort of project is so small in the scheme of things. Like, please just make a decision, because a lot of people's work has gone into that. Okay, I'm done.
Thanks, Rob. I will pass it over to Emily Lamson-Sue.
Hi, I'm Emily Lamson-Sue. I use she, her pronouns. I'm the Systems and Workforce Development Manager at OCEAN, or the Oregon Center for Children and Youth with Special Health Needs. Yes, the uncertainty is just intense. We are in the middle of our 5-year block grant cycle strategic planning, and it is a very surreal experience to be thinking forward when everything is really up in the air. But that's the way it goes. Rose is that we are 3 weeks away from our Ocean conference, our statewide conference, which is focused on bringing together folks from across all the child serving systems in Oregon to focus specifically on working with children and youth with special healthcare needs. This is our second conference. We did our first in 2023 after having it totally ready to go in 2020 and then the pandemic hitting. So we're excited to launch this again. I can put the registration in the chat if that's something that folks are interested in sharing. And that's it. Yes.
Thanks so much. I will pass it over to Jeff Knapp.
Jeff Knapp has just taken himself off of mute. I identify as he, him as my pronoun. My name is Jeff Knapp, and I am the Executive Director of the Oregon Optometric Physicians Association. Our office is here in Milwaukee, and it's a statewide organization representing about 800 optometric members in the state. In terms of a rose, in regard to this group, we got a lot of roses that are popping up here and there, but for the benefit of this group, this year we consummated an agreement with the Para-Optometric Association that brings a lot closer to our association. Those people who work in the front office of your local optometrist, and they can do anything from greeting you when you come in to somebody who can fit you with a pair of glasses or contacts and all of those different things. There are 3,500 para-optometrics located in the state. And we're working on a plan right now for workforce whereby we're going to be working very hard to get them certified on several different levels of certification. And that will bring to each of the offices, which is a data-supported increase in their revenues and also retention with employees. So we're really, really happy to now have them joining our association so that we can help them and they can help us and the doctors that are members of the association. I think that's great. And can I have two roses? We nominated someone from the Oregon Health Authority for a national award that will be presented in June in Minneapolis, and they've won it. And we are very, very happy to announce that Napua Rich, that handles the vision services, is an award winner nationally for her work. It's called the Apollo Award. And that's awarded to somebody who isn't necessarily working directly in the field of optometry, but does work to support people with vision health issues. And so we're just extraordinarily happy about that. She was responsible for an increase in a reimbursement rate that, in essence, really helps our access for more doctors offering more Medicaid services. And we're just delighted. She's just been absolutely wonderful. And I would feel neglect if I didn't mention a thorn, and that is something that we're all facing one way or another regarding federal reimbursement rates and threats to Medicaid. So thank you.
Thanks so much for sharing, Jeff. Yeah, I think yeah, the amount of uncertainty, no one will ever complain if you share extra roses in celebrations. Congratulations to your team.
Thank you.
I will pass it over to, let's see, Renee.
Yeah, I'm Renee Francis. I go by she, her pronouns, and my position is Manager of Career Development and Retention for Peace Health in the Oregon network. So Riverbend, Cottage Grove, and Peace Harbor. I would say that I have a few roses, but one of the big ones that I have love, and it tends to boom in the spring. I have developed pipeline programs for high school, underserved high school youth and young adults, so ages 6 to 26. Kind of opened up the hospital as an opportunity for them to be able to come into the hospital, get some insight into different careers. I've had several of them convert into employees, and then we kind of help them on a career path into healthcare, which is something that they wouldn't normally have opportunity for. So that's something, and that program has grown significantly, which is really wonderful. I would say a thorn that we are seeing, obviously, with the way our country is going right now, it actually, I kind of see it in a different light because we don't rely on federal grants as much as other organizations do, but we have noticed that the vibe of the hospital has been really off. Caregivers are much more stressed and edgy a little bit. And so we are trying to find ways to make them feel appreciated and recognizing their hard work so that they feel cared for as well, because oftentimes we get depleted as nurses and we focus a lot on nurses. We just get depleted because we're giving, and if we don't get our cups filled in other ways, then, obviously we can't care for our patients as well. So we're working really hard at trying to find ways, little ways, big ways to make them feel cared for so that they are able to then, serve our community in the best fashion they can.
Thank you, Renee. And I will pass it to Adam Dickey.
Everybody. Adam Dickey, Director of the Central Oregon Behavioral Health Consortium, part of East Cascade Works, and also my own private practice, which is now where I do all of that work from as a consulting contractor for East Cascade Works. I call that a positive, a rose and a thorn. Like, I'm doing great in my small private practice and doing this as a contract. I think the thorn of that is the consortium is in flux of change that is making the community have to decide how they are going to continue to have that as part of their onslaught of resources to support primarily master's level trainings for master's level clinicians in our region. And kind of to double down on that thorn, I'm just not passionate about the way that our field of mental health likes to fight with each other. And it comes up sometimes, and today it's come up in particular that mental health just needs to get their head screwed on straight and realize we should work together with each other, not against each other. And it frustrates me sometimes. I see Rob saying the same thing.
Thanks so much for sharing, Adam. All right, I think that has covered all of our advisory committee members that have been able to join us today. If I have missed any of our committee members, please let me know. Feel free to chime in and share an introduction if I've missed any of our committee members. All right. Well, thank you all. I know besides just hearing what you're all are the successes and challenges in the spaces that you work and live within, just really a helpful way to set the context of the amount of expertise and just range of work that's represented and your all's willingness to participate in this advisory committee. So really appreciate you all taking the time to share with us today. So we thought we would start with some more updates from what's been going on in the HOWTO world for the last 6 months since we had our last HOWTO advisory committee back in October. It feels like a million years ago now, 6 months ago, but way back in October, the round 6 request for grant proposals had been posted. And so that request for grant proposals, or RFGP, had a deadline in December. And so during that time, we received 103 eligible proposals for review. Those who have been around for a minute might just have a frame of reference for you all, that for round 5, we had 40 eligible proposals for review. So really big shift. We expected an increase in proposals, and we also made some changes to try and help improve access for folks to be able to submit eligible proposals. But it definitely surpassed our expectations. And so we wanted to provide a little bit more of an update to you all on both that pool of proposals as well as those who have been selected to be awardees. So I thought just a little bit of context on what that process was like, partly because after we finish talking about round 6, we're going to look ahead to round 7 and talk about changes that we might be able to make, get your all's input on what we might look forward to doing differently in that round 7. So just as sort of a context setting. Our proposal review process. So first, we heard very loud and clear during round 5 that folks wanted more time to be able to submit proposals. And so we continued that practice. We had the proposal, or the request for grant proposals, was open for 12 weeks. Once that closed, we began our review process, which included every proposal getting 3 scores. The first 2 were a part of a scoring rubric that was posted with the request for grant proposals. Actually, it's basically 2 set of scores. The first one we called it document 4, very descriptive. But the first rubric was kind of a breakdown section by section of the proposal components, a score for each section, as well as a set of criteria for what each of the different scores would mean for each of those items. So folks could take a look at how they were going to be scored as they were writing their proposals, trying to increase transparency for folks. So we had 2 reviewers compile scores using that rubric for every eligible proposal. Our reviewers included OHA staff as well as community members and advisory committee members. You all got many emails from me as we continued to recruit our reviewers to take part in this process. And huge appreciation for the amount of time and energy that folks spent on that process. And also with 103 eligible proposals, which included many partnerships within those proposals, we certainly had a more limited pool of who could participate as reviewers, which is just an aside to say, as we see the proposal numbers grow, it creates some of those other challenges. In addition to the 2 reviewer scores using that first rubric I mentioned, every proposal also got what we called a how-to team rubric score. This rubric was also included in the request for grant proposals. Again, trying to make it clear to folks, for each section of these proposals, and as we talked about program priorities and values, that they knew what that meant in practice for the scores. So each of those proposals got those 3 scores. The score sheets also include reviewer comments, so that folks who aren't awarded are able to get their score sheets afterwards in order to better understand where strengths or challenges might have been highlighted by reviewers as part of the process. The scores and those reviewer comments, as well as all of the proposals and summary documents, then went to our recommender panel. Our recommender panel is made up of some of our OHA HOWTO team, our OHSU executive sponsors, as well as a representative from the Healthcare Workforce Committee. And then they used those scores and comments and the proposal details, along with looking at things like, how do we juggle regional distribution across the state, which healthcare disciplines are being funded, the different funding amounts, some of the things that we talk about with how to program priorities around sustainability or innovation, what's the impact of the intervention that the program is aiming to create. So all of those different factors into selecting who the round 6 awardees would be. Next slide. So as you can imagine, we had the $9 million to award. As I mentioned, we had 103 eligible proposals, which included a total request of almost $81 million in funds. So there are many strong proposals that still weren't able to be awarded just because of that tremendous mismatch in the amount of proposals, the amount of funding being requested compared to the $9 million that we had available. For the last few rounds of HOWTO funds, we note in the request for grant proposals that we're setting aside up to $1 million for projects that are requesting under 300,000. And so this round, there were just 13 proposals that were in that pool of smaller budget requests, tend to be from smaller organizations, whereas the vast majority of the proposals were requesting much larger sums of money. And these projects can be for up to 3 years. Most are 3 years. We do see some that are 2, but most are for up to the max of 3 years. All right, so that's kind of setting the stage of the process and what we received. And I just wanted to share a little bit about kind of what the distribution of that proposal pool included. So one of the things that we look at across the pool of proposals is just what Oregon Health Policy Board regions are being represented. We ask both about what regions they're serving, but we also ask for the regions that will be where the workforce impact will be. All right, so for our recording, we just had a little technical difficulty, and so we were just walking through the rest of the OHPB regional representation across the pool of round 6 proposals that were received. So just a quick recap for those of us who weren't able to attend or who are listening to the recording afterwards. Just to say that we had the most representation across the metro region as well as the Willamette Valley. So again, not particularly surprising. We see that in previous rounds as well. But we did have several proposals, 14 that covered the coast, 20 for Southern, 11 that were serving the Eastern region as well. So I think compared to previous rounds, we are seeing a little bit more range serving Eastern and Southern through the proposal pool. So that's something that we just kind of continue to think about how we can ensure that we're representing across the state. All right. Any questions before I kick us into the next one, which is just looking at the disciplines that were represented? All right. So again, every round is a little different. This round, we saw the most representation in the behavioral health field for proposals that were submitted. Traditional health workers also had a large representation across the proposal pool. Again, many of these are looking at multiple areas of the healthcare workforce. So like we might see a project that is supporting medical assistants and healthcare interpreters. So the categories here and the counts aren't mutually exclusive. But just wanted to share again sort of that sense of what was included in the proposal pool across the many different areas of the healthcare workforce. One of the challenges and one of the benefits is that the HOWTO request for grant proposals is open to all areas of the healthcare workforce. And so just trying to think about there's so many urgent needs in so many different ways, and just wanted to continue to help show what areas are appearing in the proposal pool as well. All right. So I will walk through a few of these for those who those on the phone or who might not be able to access the slide themselves. There were a few 5 proposals for K-12, 5 K-12 education, 5 that were focused on nursing, 4 that were looking at healthcare interpreter, and then 4 for surgical tech as well. This year we had also 4 for medical assisting and 3 for oral health. Residency programs, we heard Rob talk a little bit about some needs there. We had 3 residency programs that were in the proposal pool. We also saw a wide range of other areas like public health, emergency medical services. We also had non-emergency medical transportation in the pool, clinical lactation education, long-term care, leadership program, occupational therapy, just again, really wide range of representation. And I will be saying this many times to folks who are seeking feedback that applied in the proposal pool that didn't get funding, and I know I've said it at least once already today, but in a pool of 103 with more than $80 million in requested funds for the 9 million that we had available, there were just an incredible number of strong proposals. It was a highly competitive pool just because of those limited funds. And we were able to award 13 projects of 103. So again, just really difficult choices, and again, not a limit on the number of really strong proposals that we did see in the pool. So in the current context, it is nice to be able to give folks good news. We were able to connect with our 13 awardees and give them the good news of their round 6 award and have received confirmation from folks that they're able to accept. Again, folks submitted these proposals back in December or earlier. So we have connected with everyone in the current context to make sure that they are able to pursue and accept the project as it was proposed. And we're still very early in these next steps with folks. We're just gearing up to do the drafting of grant agreements with the goal of trying to get the grant agreements executed and start to get funding out the door to them as quickly as possible. But we just have a summary slide here to show you what projects were selected. We'll also have a lot more information that we're able to share out as we move through the process to get project abstracts shared out for each of the proposals. You'll also be hearing from grantees in our future all grantee meetings and things like that. So we're just getting started. But of that pool of projects that were requesting less than 300,000, we had 4 awardees. One was clinical lactation education with the Black Parent Initiative, healthcare interpreter project with Chemeketa Community College. Empower Therapy is one of our behavioral health field projects. And then Reynolds School District has a dental assisting project that they have been awarded for. And then we had 9 projects for those that were requesting over 300,000. As you can see in the table, most, and I think the average in the pool of folks that had proposed in that larger budget range, I think the average ended up being like over like 800,000 that folks were requesting. So we had 9 projects there. African Youth and Community Organization, BCT Partners, which is an emergency medical services project, Familias and Acción, which is a community health worker project, Friends of the Children of Klamath Basin and Insight Counseling and Therapy are both behavioral health focused projects. La Clinica is a patient services representatives focused project. It's also a partnership with high schools to get students healthcare exploration and career exposure as part of those projects. Portland State with a behavioral health project. Portland Workforce Alliance, which is working with young adults and youth for getting additional healthcare experience. And then also United We Heal. So wide range of projects. The column on the far right is showing the region for the workforce trainee impact that they included as part of their proposal. We didn't include the full breakdown of counties within each of those regions, but I would highlight, so 2 of the awardees serve the coast. We've got 3 that are serving southern OHPB region, 2 for Eastern and 2 for Central region. Again, and these are not mutually exclusive, as you can see in the table. There's several of them are serving multiple regions. Then we have 6 for Willamette Valley and 6 for the metro region as well. And one of them is a fully statewide or all OHPB regions. So just getting started with this group and excited to be able to have more to share with you all as things move forward and have the grantees. And this is listing the proposer organization. Many of these projects are partnerships across multiple organizations. And so being able to have more information to share with you all and to have those folks as part of the HOWTO grantee community for our all grantee meetings. We've also started doing HOWTO quarterly grantee collaborative meetings where it's a space for grantees to come together and share with each other challenges and successes around topics that they're interested in sharing and connecting with each other about. So having more folks as part of that community as we learn from each other and grow. Just threw a whole lot of information in that one slide and that one table, I realize. Are there any questions or things that you'd like to learn? There's so much I know that we can learn, share more about in the future. We'll definitely be sharing abstracts and things like that with the group as the projects move forward. But any questions or curiosities or all of those things that might be bubbling to your mind as we look at this. Also, just be quiet for a second so you can absorb that slide. All right. Yeah, I would say it's in the climate of so much change and uncertainty, it is exciting to have good news for folks and get to think about the growth that comes from for the How-To program, the learning that comes from these things. It's a nice bright spot in the current context. So more to come for sure. All right. Well, with that, we actually are set, if I'm remembering. Yes, we are set to have a 10-minute break. So now that we've unloaded all this information on where things have been, what we've been up to, we're going to come back and talk about what's ahead. So this context to set the stage and think about what we are looking forward to in the next round. Hopefully, give ourselves some time to soak that in. Get away from our computers for a second, and we will come back at, we'll say 2:38. So we'll come back in 10 minutes. Thanks, everybody. Feel free to make sure you mute, go off camera, and we'll come back in 10 minutes. All right, thanks so much for coming back for the second half of our meeting, where, as I mentioned, we're going to be spending more time thinking about what's next, what's ahead. All of that to help us start to think about what the next round of funding looks like for How-To. We've got some estimates, some possible timeline suggestions, and basically what we were looking at are, first just timeline. Thinking about folks who are working with legislative session, folks who are working with academic years, schedules, and things like that. And so the possible timeline that we're looking at right now is suggesting that we post the next request for grant proposals next year. So it would be April 2026. similar to what we have done for the last two rounds. We would keep the request for grant proposal open for 12 weeks. So that would have the deadline in June. That might be around the end of academic years for some folks, depending on what industries, organizations they're working on. And then we would be doing the review and selection between after that June deadline, with the goal of doing notification of awards in September 2026, which is hard to imagine that we're planning so soon that 2026 will be here. But this would have similar timeline periods and chunks as what we did for this round. And then the way that HOWTO funds work, it is based on, it's a billing cycle. It does fluctuate with like Medicaid caseloads and things like that. So this would give us enough billing periods to continue to accumulate funds between now and next April, so that we would hope to have an estimated amount of funding for approximately 4 million. Because of how the intergovernmental transfer arrangement works, there is, like I said, some fluctuation from period to period. So we'll have, it would be a total of 6 billing cycles that would count towards this round 7 of awards. So we'd have a better sense of what the total amount would be as we got closer to that April timeline as well. So a couple of things. There's the logistics piece, right? So how much money and when? And then thinking about what trends we've already been seeing, right? So we're seeing a tremendous, there's never a shortage of need, right? Everything has urgent need everywhere, it feels like. We're grateful for the increased awareness of the program. Also, though, we know there's increased urgency of need, and that increasing pool of proposals is likely to continue. And so what are the things that we can do differently for future rounds? One, trying to acknowledge the huge lift that submitting these proposals are for organizations. And as we continue to have a larger pool without an increase in funding that's keeping up with that, how do we try to make sure that we're not asking folks to continue to invest all that time and energy when it's about what a little more than 10% of folks that received funds, or a little more than that, but it's a small percentage of folks who propose. And as we are trying to make sure that the proposal process is accessible for a wide range of organizations, we know some of the folks who submit proposals are small organizations. They don't have dedicated grant writers, taking time away from their other work to submit. So how do we think about our process in that context to try and not see a ever-growing pool with a smaller and smaller percentage of folks who get awarded. So some of the things, that jump to mind for me are thinking about, what are their focus areas that we could kind of narrow in from round to round. We're always thinking about process changes. How do we make the lift for what we're asking for folks to submit? How do we change that to get more of what we need to feel like we're able to evaluate the proposals and reduce the administrative burden? But really kind of coming to this group, we've heard a wide range of expertise, experience organizations that are represented in the advisory committee. So also just wanting to brainstorm with you all what you've seen, the context that you're experiencing, what are changes that we might consider for round 7 to think about how we continue to adapt
So I'm gonna say something here. So I think, you know, it would be really nice if we could know what the greatest area of need is. Clearly, behavioral health has been, I think 5 out of the last 9 had some behavioral health element, which is always a problem. And so it'd be really nice if we had some measurement of need. I can tell you that, I mean, I know in my own particular profession, I know what the needs are for Oregon, and they're in every specialty. And when you have behavioral health folks, including other doctors with a great need for psychiatric expertise, that's the biggest area of need in medicine, I'm going to say. And this has been really apparent for, well, ever since I moved to Oregon 30 years ago. I mean, this has been a long-standing access to psychiatrists for Medicare and Medicaid patients is almost non-existent east of the Cascades. But there's probably other areas of great need that, I mean, I'm not aware of, but other people. So no matter what you do, I think that's far too many proposals for the amount of funding that's available. So I think you'd want to cut it down to, like, I don't know, 15 to 20 maximum, and pick a focus area. It could be dental health. It could be eye health. It could be something, and then write the parameters that are very specific to that instead of making it as wide open as possible. The other thing, if you want to narrow it down too, there are certain grant programs that require a commitment for ongoing sustainable funding. And if you can't prove that, either through a commitment letter or some process like that, which I've seen in many grant proposals, like, for example, such and such institution is committing $5 million in 5 years worth of funding following the institution of the HOWTO program. Doesn't have to be 5 million. I'm just picking something out of the air, but that would probably help in narrowing down the number of proposals, because for it's not a lot of money. $4 million, unfortunately, is not a lot of money. It's a lot to you or me, but for all these programs, it's not. And so I think we have to get to a point where you have a reasonable number of reviews and not spread it so widely. But that's my opinion.
Thanks for that, Rob. So hearing, and I'll be taking notes in addition to our recording, just so it's really appreciated that we have this brainstorm. Think about hearing from Rob, both that support for that kind of narrowing focus to a smaller pool, and also that idea of whether or not there's something towards a commitment towards what happens beyond the end of the HOWTO funding. So leaning into that sort of sustainability of funding beyond the period, and not mutually exclusive. As the ideas bubble up, please feel free. I see Carrie. Yes, please.
As far as other target areas, certainly nursing is one of them, but I think more broadly, it's the entry points into a variety of patient care roles. Like if you look at it as a pipeline, so CNA.
Carrie, it's a little hard to hear you. I'm not sure if that's just me or others as well.
Sorry.
Okay.
Do you want me to type my thoughts?
No.
Can you understand me at all? Okay. So, as I was saying, I think entry points into patient care pipelines would be the best, sort of like a good target. So it could be a lot of tech roles. It's a lot of those. Some of them are shy of even an associate's degree. They can be pretty quick. but I think targeting specifically something that is intended to build toward a recognized credential that someone could be hired with, and then maybe their employer does reimbursement and helps them on that next stage in that pipeline. But a recognized hireable credential, I think that's a very, very it just seems like a better ROI, frankly, and it's really going to move the needle as far as actually helping both the patients with their access and the individuals when they have that credential. So that's kind of my suggestion.
Thank you for that, Carrie. So thinking about that hireable aspect and maybe even leaning into that higher those outcomes reporting that come from that. So a pathway. I also heard you mention something about the connection to what the employer commits to afterwards. Is that?
No, I didn't I said, so basically I was saying, if you got something where someone's built to a credential that they are a recognized healthcare credential where they are hired, frequently their employers will do employee reimbursement for further education and credentialing and what have you, but they get into that entry point. Part of this is because a lot of those introductory patient care roles, frankly, don't pay very much. So if you eliminate the barrier to getting that first credential, you have a bigger impact even downstream than a lot of these other programs.
Yeah, I think I understand. It would be like funding a program where you could guarantee 10 people get their CNA with the being hired and then having the opportunity through an organization to proceed on to get a BSN or whatever, right? Absolutely. I mean, that the credentialing is really, that's a good idea, I think.
Thank you for that. And I think we also have some current grantees who like the Clinica's projects helping to see folks move forward that may already be in other roles within the space and have the opportunity to progress in their career. So I think we see good evidence of that success even within the HOWTO world.
I second that motion. Love the credentialing idea. I mentioned at the outset, talking a little bit about what we're doing with the Para-Optometric Association, and it falls right in line with that whole concept. And so love it. And our field, as I'm looking at the different areas, and one of the reasons that I joined this group was to get optometry included in this. And it is an area that is sorely missing a lot of awareness, but the workforce and recruitment and certification is a fantastic concept. So thank you.
Thank you for that addition there, Jeff, as well. One thing I'm just thinking about as we are having this conversation so far, I'm hearing a lot of it is about the very beginning, right? And as Carrie was mentioning, the challenges around wages for those entry level roles. Is that something that, thinking about focusing in on one area of that sort of career trajectory, is that something that the group is looking at as a possibility there? Also knowing that part of why we don't see the other side is that the pathways aren't aligned very well, right, for folks to advance across different roles. But that's just one thing that jumped to mind as I think about proposals or our current grantees where we see more of that connection, maybe from youth, young adult, even like high school programs to get folks into those very entry starting point of pathways. And so whether or not that's an intentional emphasis or just or maybe just what we've seen so far.
The other thing also we talked about last week was the concept of, and I know there's pluses and minuses to this, but going back to what Rob said, 100 and X number of applications for this amount of money puts a huge strain for, relative. So, one thing we were discussing last week for the people to provide feedback on was do we do a letter of intent process? So you put out the RFP, you do a letter of intent, and then there's a pre-screen, and you invite however many you think you should have, which is 20 or 40 or whatever the magic number is, in a specific area, maybe that that is like being talked about now. So that's another way of narrowing down the number would be one way of doing it.
Thank you for that, David. Yeah. I hear it's a couple of sort of that logistics piece where we think about, is there a way to narrow the focus either by creating a subset from the beginning, or even if we do pick a focus area, if there's a process that we could use to kind of get a gauge of what the possible proposals are, and then invite those that are most fitting towards a focus area, or again, we'd have to come up with some rubric for that to help pre-screen what we see next. Other ideas or concerns where we that are coming to mind as folks are thinking this through as possibilities.
I think the other thing, potentially, a lot of the proposals we had this time there's a certain amount of overlap between the proposals we got and what was done for submitting for Future Ready Oregon. I think, is that correct? The other thing, whether we should create a niche, a tighter niche area so that, a lot of people put proposals into both, which, if I'm a grant writer, that makes sense to me. But, it floods the system right as opposed to, really try. So I think that's what you're trying to suggest, but really taking a look. So what I'm proposing is take a look at what other funding mechanisms are out there and pick something that isn't covered, or, pick a niche area that's not fully covered or something. So, if that makes, I don't know if I'm making sense, but
yeah, so trying to think about the what are the criteria that are already covered, right? And we've talked about that for Future Ready in the past, and their funding moving forward is, my understanding is they don't have additional funds to award unless something changes. But thinking about what groups are eligible to apply for HOWTO versus other projects, or where the types of programs might already be getting plenty of representation and eligibility in other spaces, and we identify an area that's not getting covered. I would say too, we also see the vast majority of proposals are about recruiting folks into the healthcare field. We don't see as many projects that are looking at retaining. Sometimes that's because where do we have leverage in a training program if it's about work environment versus training, right? Can we solve the problem of retention in a particular field, or things like that? There's a different set of challenges. We also don't see as many as what we've already been talking about that advancement. So folks who are in a field and either want to advance into related roles or different roles, or gain additional skills. So definitely over the recruiting into the field are what we have the most representation of. Carrie, it looks like I think you had something to add too.
Yeah, can you hear me if I lean forward? Is that helpful? Okay, sorry. I think when it comes to the retention piece, I mean, ultimately that's up to the employers, frankly, but if you're talking about career advancement as you're going forward within there, typically, again, that's acquiring additional credentials and additional training. So I really, I hate to be kind of keep harping on this, but I really think that is the only way to move. Like, what are we trying to do here with these grants and these projects? And to my mind, it's to increase access and alleviate the shortage of qualified workers across the board within healthcare, be that optometry, dentistry, behavioral health, traditional medicine. And so we target what we want from these proposals to address that problem and that lack of access. And I think if we really want to get the most out of these limited funds, it's got to be folks who can shortly after participating in these programs hit the ground running in healthcare.
Thank you for that, Carrie. And I would say not, you said something about harping on. I think it's reiterating, helping us to see the connections across the continued conversation. So I appreciate it. Other ideas that are coming to mind for folks. And again, this conversation doesn't end today. This is going to be something that we'll continue to work through and seek feedback on, especially if we aim for that April timeline, right? We've got some time to come back to you, maybe sharing some additional details and collaboration by email and things like that as well. Anything else that's coming to mind as folks are thinking about this?
I I hate to talk again, well, I don't, but there's another idea. You know, in my work with Area Health Education Consortium, AHEC, it's amazing what you learn about how high school students and younger don't have access to experiences in healthcare. I mean, they have no idea what respiratory techs, lab techs, nurses, doctors, all these people, and the opportunities, which is a major problem for recruitment. But you may, you know, in the proposal, you could say we're only going to accept proposals that enhance access to learning experiences for a certain group of people, high school students. You could limit it that way too. And if you wanted to target a different audience, like optometry has never crossed my mind, but we really should introduce people to the opportunities for optometry in AHEC, right? It's just because I'm in a hospital and, you know.
Thanks, Rob. And I would say too, we also hear from both grantees and also in my own previous professional experience, the challenges of connecting between the high school, the healthcare system, and then the training program. So another thing we could think about is if we're asking about certain partnerships or are there bridges that we're interested in facilitating? Because the opportunities to increase exposure. Also, then if there's not a training program in the state that meets that particular healthcare workforce role, or the organizations are struggling, the lift for a high school or for a clinic to help support a high school student in that space really is coming back to those partnerships as well. At least something that jumps to mind for me as I hear that from you all. Other ideas? Give it. We have one more topic to cover for our meeting today, but also this is a big part of the heart of what we do next. So really appreciating the brainstorming. And I know, if there are other committee members who haven't had a chance to chime in, also not always happy to hear from those who have already chimed in as well. But if there's any additional committee members that might want to share ideas, whether that's in the chat or coming off mute. All right. Well, as I mentioned, not the end of the conversation for today, but as this sits in your head, if more ideas come, please don't hesitate to reach out. We'll be drop in the how to, actually in one of our final slides, we'll have the how to, we'll finish off with the how to program contact address on the final slide as well. But feel free as ideas come to you to please feel free to send an idea our way or reach out if there's a conversation to be had, and we'll circle back on what we see as our next steps. Another part of what our next steps are, though, are related to the committee itself. So time flies in a somewhat frightening way sometimes, and it has actually been 2 years for the majority of our committee members who have joined. So we're also thinking about for those who are interested in continuing as advisory committee members, we're going to be sending out a survey to gauge folks' interest in continuing to participate. The How to Advisory Committee charter doesn't have a limit on the number of terms for folks who are interested in continuing. So we'll be reaching out after the meeting to get a sense from folks on who has both the interest and the capacity to continue as an advisory committee member. For those who aren't able to continue, again, the meetings are still public meetings, and so we would always welcome to have you continue to participate as a member of the public and continuing to keep how to on your hearts and minds. We also have had a couple folks who have either changed positions and are no longer in contact or have already let us know that they're not going to be able to continue to participate. So we know at a minimum, we're going to have a couple open advisory committee member positions to recruit for. So what we're thinking about as we think about some more upcoming next steps long before next April, here in the next coming weeks and months, that we would like to begin recruitment for the advisory committee. Once we have a sense of how many folks are continuing and how many roles we have open, we'll be able to kind of get a sense of the number to fill. We'll also have a sense then again about what regions, healthcare disciplines, organizations, lived experience, all the aspects of experience that we would like to see represented. And knowing that we typically have to do some additional focused outreach, just like thinking about this group. Just 2 years ago, we didn't have representation for Eastern Oregon, and came back to the committee and came back to our contacts to try and get additional applications as part of that process. So we'll have a little bit better sense once we hear from everyone on their plans to continue. Again, it'll continue to be 2 meetings a year. We've gotten input from folks on kind of a pretty wide range of what folks are interested in hearing more of or less of, but similar time commitment moving forward. And so we will be doing the application and recruitment process that's in alignment with the Oregon Health Policy Board application or committee guidelines. So those applications ask folks to share more about their health equity experience, their knowledge, skills, and lived experience, cross-cultural experiences that they think will help the committee to better address health equity and the goals of the HOWTO program related to helping to address healthcare workforce shortages and diversify the healthcare workforce. So that process will be coming soon as we work through that. We're also going to be asking for your help if you do continue to want to take part, both for application review. We'll be creating a rubric to help us narrow down, assuming we have a plentiful number of folks who are interested in participating, trying to narrow down and select the future advisory committee members who will be joining us. So we'll be asking for committee member support around that selection process. We're also going to be asking for your support in the outreach aspect. This is the hardest part and continues for every committee I have seen take part in these different processes. It's tough to get folks who are interested in participating for all kinds of different reasons. And so one of the things that we're interested in hearing from you all, so basically what we'll do is we'll create a short blurb that both describes the program goals, and what the advisory committee member role is, time expectations, all of those pieces. That would go out as well as a link to the application itself. And so we know one of those big challenges is around getting that information to as wide of a net of potentially interested and able to commit folks. And so having your support and ideas on how we can help to do that. If you have seen areas of success or things that you have seen that have not worked, having that input and feedback from you all is really helpful. So we also wanted to open up the conversation in our last little bit here to the advisory committee members if you have input on that aspect of our next steps in helping to fill the advisory committee roles. Anything that folks have seen work well. Back to the roses, maybe.
If you could narrow it down to specific geographic areas with specific, healthcare areas that we might be missing, that would be awesome.
Yes, we will definitely be looking at that once we have an idea of who's continuing on both the regional distribution and what areas are and are not represented. We will do that, and that hopefully to help us do that additional focused recruitment. Other ideas on what might help? Part of what I'm hearing is it is an ever challenging task to try and recruit for committees. I would say similar to what you all just heard me say on our previous discussion is if you have additional ideas that come to mind as we move beyond the meeting, please don't hesitate to reach out. You will be, as always, getting additional emails from me as we move through this process from either my personal, the melissa.yates email, or more likely from the HOWTO shared inbox. So appreciate you keeping an eye out for those updates, as well as the survey that's going to come out. But again, even if you aren't able to continue to participate in the advisory committee as an official member, we can still we would readily accept and be very grateful for any help you can provide on helping to spread the word as we get more information out. Any other ideas as we kind of wind down for our meeting today? All right, well, that brings us to the next slide, which is just, again, appreciation for your time and energy and sharing the thoughts and ideas that come to you now. And as we move beyond the meeting, really appreciate your participation and commitment and support for the program. We'll have more information to share with you all soon. Keep an eye out both for that survey on whether or not you, I think it's the vast majority of folks that will be getting that survey from me, because we expanded the committee 2 years ago, so everyone came up at the end of the 2-year term at the same time. So absolutely appreciate you all keeping an eye out for that survey to let us know if you want to continue to participate. After we have that sense, then we'll also look ahead to planning the next meeting, which will be in October, and do some surveying and dates around those things. But the top priority is going to be that recruitment piece. So you'll have more information from me coming up soon. And then that brings us to that last slide, which also has the HOWTO shared email address to include for you all. And could I get the next slide? I'm guessing glorious technical difficulties. I will drop the HOWTO program email into the chat for everybody. But really that brings us to the end of our meeting for today. So like I said, feel free to reach out, let us know if any questions or concerns or further ideas come up. Otherwise, you'll be getting an email from me soon with those next steps. Thanks so much, everybody.